Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. Lea, thank you for joining me on Here for Good, the Inside Edition.
Thank you for having me.
How long have you been here, and tell me where you work?
I'm an ED physician, attending physician at Lourdes, Our Lady of Lourdes in Camden. I just passed 3 years, but I kind of grew up in the system. I went to Rowan for medical school, and so I've been closely associated for a long time.
I knew that you were an emergency room physician. I was also told you knew from an early age when you were just a kid that that's what you wanted to do.
Yeah.
I remember when I was young, I wanted to be one of the guys that rode on the back of a garbage truck because I thought it was the coolest thing in the world to be holding onto that truck, jumping off. But you knew you wanted to be a doctor. How did that come about?
My parents worked as volunteer EMTs. And so back in those days, I was maybe, 10 years old. They parked the ambulance out front of our house and would respond in plain clothes from our home. And I would often ask to go with them, and I would try and sneak on and ride in the ambulance and respond to calls.
At 10 years old?
Loved it. I loved it. I can distinctly remember particular calls as well. I remember a big crash scene where my dad had to crawl into the window of a vehicle to render aid.
Now, you went on to become an ENT as well, correct?
I did. I was an EMT.
EMT.
After college, and I did that as my short-term career for about 5 years until I went to medical school.
Now, did that experience as an EMT help or hurt you in medical school?
It helped in the clinical aspect. I never felt the fear of walking into a patient encounter. I had that experience, and I leaned on that experience.
You went to medical school at Rowan.
I did.
And this was before the academic affiliation between Rowan and Virtua. Do you see that affiliation, however, benefiting students now?
Especially as a South Jersey resident, to take Virtua, which has been here in this area for so many years, and to Rowan, which has been in the area for so many years, and to combine these two, it kind of just feels like regular people from South Jersey no longer have to go anywhere to follow their dreams, to be a physician, to get the sound education, and then, like me, stay in the system and continue working here, living here.
When you were a student, did you have any rotations at any of the Virtua locations?
I did a couple. So I did, when I was a student, I did a few rotations at Lourdes, specifically in the intensive care unit with the cardiology team. I went into the cath lab. And then in residency, we do 2 months at Virtua and Voorhees in the emergency department. In the pediatric emergency department, I did a month.
So the medical students and the residents that you encounter today, now that you're on the other side of things as a practicing physician, is there any advice you give to them that you've learned either from being in their shoes or now that you get to see it from the other side?
Sometimes becoming a physician can change you, but I think that if you just remember that you wake up the same way everybody else does every day. And I give this advice to the students coming. I said, just be a normal person. Walk into a room, interact with your patients as though they're just normal people, just like you and I, and remember that you are one of them. That'll take you so much further than any academic medicine.
And that's such a great piece of advice because it tends to normalize things for people.
Absolutely.
And it disarms them and help them to give you the information you need in order to help them.
Absolutely.
Shifting gears just a little bit and going back to family. Is it true that you met your husband while you were an EMT?
My husband's a police officer. He's a sergeant now with the department. When we both started, he was a very new, only a part-time police officer, and I was a young EMT. And we met on 911 calls. We had some pretty unfortunate calls that we started to see each other often on these these while responding, we always had police response.
Okay.
Just for the safety of both patients and EMS. And I remember carrying a really heavy piece of equipment up the stairs, and I got to the very top of the stairs, and he said, "Do you need help with that?" And I said, "Well, I'm already up
He waited till you got up.
Yeah, I was
It's
already
not-
upstairs.
I don't blame him.
But yeah, and then we became friendly, and now he's my husband.
Now he's your husband. And so do you have a family together, or is it
We
just
have
the two of you?
We have 2 children. We have Connor, who's 7 years old, and Emma, who is 3. We have a dog, and we live in Washington Township, where we plan to stay.
Tell me a little bit about working in the emergency room. You have a chance to really change the course of not just someone's day, week, or month, but their lives.
Yes, I think it's the most gratifying job in the world. I have the opportunity to meet patients often on their worst days, critically ill, in pain. And I think that if I can be a normal person and walk into the room and also provide the appropriate treatment plans, hold their hand while they're going through whatever it is that they are, when people say thank you, that means the world.
How do you avoid taking some of that pain home with you every day, especially when you're talking to some of the medical students and the residents? What do you tell them about self-care and how to avoid some of the stress of burnout and taking that pain home with you every night?
We debrief in our emergency department after difficult cases. So no matter what else is going on in the department, the team and I go to a private area and we talk. We take 5 minutes. We let out the frustrations of the case. We talk about it. I have the best, strongest emergency medicine team, the nurses, the ancillary staff, and we lean on each other. And
So the value of that team
huge.
is not only for the patients, but for the caregivers as well.
Yeah,
is what
we're
you're saying.
there for each other. We're friends, we're colleagues, but we lean on each other to get through those days. And sometimes I do take it home. And luckily, I have a husband who's far enough removed from healthcare, but sort of understands that emergency response. And I lean on him and I use the people in my life to help me get through those difficult patients. But more often than not, it's the good outcomes that really I try to focus on, the happy outcomes.
Could you ever see yourself doing anything else?
Not even a thought about it.
And you know what? I am happy to hear that, because it's physicians such as yourself that helps us in our mission to help people get well, stay well. And just, it's a joy for me to hear that coming from you. And I'm so grateful to have you on our podcast today.
Thank you. Thank you for having me.
No, it is my pleasure. And yet another wonderful story from one of our wonderful physicians demonstrating what it is to be here for good. So tune in next time for another episode of the Inside Edition.